So excited. So my name is Alexis Davis. I'm the social media manager here at RSDSA. I'm joined by Jim Broach, our executive vice president and director of RSDSA, and Dr. Neal Pollack, who was our first Facebook Live guest of 2022. Dr. Pollack is a board certified neurologist and a director of neurology and pain treatment in Milwaukee, Wisconsin. He's a fellow at the American Academy of Neurology, a fellow at the American Academy of Disability Evaluating Physicians, and is a state of Wisconsin neurological and orthopedic disability examiner. We are so excited to have him here with us tonight, as he will be referencing principles and practices from his new book titled Pain Relief is Only One Call Away, an interactive book enabling contact with a pain specialist. We will also share the link to purchase his book throughout the presentation, so be sure to look for that in the comments. And we are thankful because we will also be receiving proceeds from purchases. So once you are on the page to purchase his book, once again, I'll post the link in the comments. Just be sure to click add a note before you check out and type in RSDSA so we can benefit from your purchase. Now, remember that while the information shared here tonight is helpful, please consult your physician for personalized medical advice. So before I let our guests begin, Jim, do you have any announcements?
Yes, thanks, Alexis. First, I want to wish everybody a healthy, happy new year, and we're really glad to be back. And we want your input about speakers for this coming year. We're really excited about our presentations, and we really want the input from the CRPS community. As we begin 2022, we're going to do a lot of programs, and our first program is a cook-off and a Jeep show down in Lafayette, Louisiana. So if you're nearby on February 5th, it's a fabulous event, and there's just so much gumbo and just really great food that you could participate in and meet others with CRPS. Also on April 30th, we're bringing back our duck race, where rubber ducks we're doing with the Coalition Against Pediatric Pain, and those proceeds will help fund our co-sponsored pain camp. Sadly, we're not going to do it this year because of COVID, but we pray that we're going to do it next year. And finally, we're going to host our third annual virtual walk on June 11th. And so save that date, and we'll be sending more information. But I'm really excited about Dr. Pollack's talk tonight, and Alexis, take it away.
Definitely. And before I turn it over, just want to remind everyone that if you want to stay up to date with all the amazing things that Jim just mentioned, be sure that you are subscribed to our email list. I'm going to make sure that I put that link in the comments as well. But you can find so many different things, of course, across all of our social media channels and on our website. So just go to rsds.org. And once again, I will put the link to subscribe to our newsletter in the chat. But that's enough on our side. Dr. Pollack, we're going to turn it over to you.
Well, thank you. I want to thank you, Alexis, and Jim Broach for giving me this opportunity and helping me with this presentation. Let's put on the first image. There's another image that I want you to see, and this is it. If you have RSD, you probably feel like the person who's depicted in this image. They tell you that you have to live with this. Well, I'm here to tell you and show you that you can improve your wellness and decrease and/or eliminate your pain. I've interacted with thousands of pain sufferers, and I'm no stranger to pain. I'm no spring chicken. I've had my share of injuries. I've had my share of illnesses. I feel pain on a daily basis. I know your pain is very specific. You have these horrible dysesthesias and sensory abnormalities. You have swelling, immobility, discoloration. It even affects your mood. Your emotions are agitated. From the time you get up in the morning till the time you go to sleep, if you do get any sleep, it's your body and your thoughts. They're saying pain, pain, pain. You think twice about doing even simple things, putting on a piece of clothing, taking a few steps, having some social interaction. Well, it's like you're taking over. I want to show you some images. There's 3 people who were pain sufferers and they were not taken over. Let's put on these 3 images. The first one is Bobby Jones. He was the best golfer of his time. He golfed in the early 1900s, and in 1930, he won what is called the Grand Slam. This consisted of the most prominent amateur and professional events in the world. Bobby Jones also went on to become a Harvard-educated lawyer, and he was responsible for the development of the Masters Golf Club and the Masters Tournament. Bobby Jones suffered from syringomyelia, a cavitation of the spine. How he golfed with this is unbelievable to me. This caused muscle spasms and severe pain. Yet he was able to not only golf, but to thrive. You know the second image. This is John F. Kennedy. He suffered from Addison's disease and chronic back pain. And he was on medicines around the clock. The third, this is John Merrick. He lived in the 1800s. He was referred to as the Elephant Man, obviously horribly disfigured. He had a bone abnormality and what is called neurofibromatosis. He was able to function, and with the help of his physician, he wrote a book about his condition, which helped many others. They thrived. You can also transform and transcend. A lot of people have talked to you about pain, and I'm different in 3 ways. Let's take these images off. I want to tell you about, number 1, how I'm different. I wrote this book. This book gives you a successful plan. It gives you a roadmap. In addition to just the roadmap, you have a call-in number. You can interact. I want you to interact because it's important to form a relationship. Alexis alluded to the fact that portions of the sale of this book are going back to RSDSA. Number 2, I want you to explore your mind's healing abilities. Thousands of years ago, Hippocrates said, the mind is the greatest force to produce and promote healing. I'm going to show you techniques to develop awareness, focus, relaxation. It's going to help you free your energy, give you peace of mind, stimulate neurochemicals that are better than the chemicals that you take, and it's going to decrease your pain. Number 3, chemicals, pills, injections, the usual injections. How are they working for you? In my experience, you get a lot of side effects. They don't cure you. They may give you a Band-Aid effect, but you can't rely on them completely. I do want you to be aware of a treatment that I've been exposed to that a lot of doctors have not even heard about. It's called perineural therapy, and it involves the injection subcutaneously under the skin in the vicinity of specific sensory nerves that resuscitate these nerves. It's been terrific for neuropathic pain, and it's something you should explore. Let's shift gears now. And I want you to be aware, and I'm sure you are, when you have pain, your focus is directed just on this pain. You get patterned. You buy into it. You see things a certain way. You get certain habits and certain conditions. I'm going to show you a video, and I want you to pay attention in this video how many times the ball is passed. Alexis, would you show the video, please?
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13.
Now, when you were watching that, did you also see the bear? Let's take a look again.
This is an awareness.
There's a
But
second part
did
to
you
this.
see the moonwalking bear?
As they say, it's easy to miss this, and most people do. So you're not alone. This is an awareness test. It's by Chabris and Simons. And it is telling us about our selective attention. We look one way, we don't fully see what is happening around us, and realize that we perceive things this way and open up. We sabotage ourselves. I want to show you some specific technical methods that are outlined in this book. And I want you to meet one of my patients. Beverly, come right over here. This is Beverly. Beverly has RSD, and I'm not going to touch her too hard because you know with RSD, it's sensitive. Her arm and her shoulder bother her. She has these abnormal sensations that have been very painful. She has swelling, discomfort, and immobility. I want to go over some awareness exercises first. You know which is your primary hand.
Yes,
You know which is your primary foot.
yes.
So you do. So how did you know that? Because we're going to take a step. I'll take a step. And her first step is with her right foot, which indicates that's her primary foot. Now, I just want you to balance yourself and try to just find a comfortable spot with your feet. Now, I'm going to touch her lightly, either pushing her backwards or pushing her forwards. I'm going to try to get her off her balance point. And I'm not going to do it hard, but I was able, and I almost pushed her over. I'm glad I held her from behind. I was able to push her backwards, and I didn't do it hard, but that indicates to me, and I'm going to show you with my hand and describe it, that unconsciously, she had weight not in the center of her foot, but towards the back of her foot. So now we're going to adjust, and I've never done this with her before. So just lightly kind of go back on your heels and up on your toes. Just keep your feet together. Watch me. I'm going forward and backward a little bit, just rocking. And I want you to find the center of your feet. Once you find the center of your feet, I'm going to repeat this. And make believe you have roots and you're just sinking, and let yourself relax into that. Now, I'm pushing you 3 times as hard, and you're stable. This is an awareness test that shows by paying attention to little subtleties like that, it can make a big difference on how we compensate and how the rest of our body lines up. I want to now go over breathing techniques. Most people do not breathe completely, and it's important to pay attention to your breathing, because breathing can give you increased oxygenation, increased energy, increased focus, and muscle relaxation. Find where your chest bone ends. It's called your xiphoid process. It's right there. When you're ready to breathe out, I want you just to gently push in.
because your air is like, your lungs are like an air sac. All right. Now, when you're ready, your air is going to come to you, and just pay attention to it going through your nose and all the other passages, and then your stomach pushes out, and just let it reverse. And continue to observe how that goes in and goes out. And focus on it. If your mind wanders, bring it back to that. By doing that, like I said, you're going to increase your oxygenation. You're going to increase your focus. You're going to increase your energy, and your muscles are going to be released. It's so important to do this. When you increase your focus specifically, it is going to completely internalize and lower your thermostat. Most of the time, we are paying attention to what's going to happen, and it makes us anxious, or paying attention to what has happened in the past and spending energy on that. The third thing I want to go over is a muscle relaxation technique. With this condition, we tend to have resistance. We don't want to hurt anymore. Now I'm going to use the other arm instead of the arm that bothers her, but there's a force called gravity. If I take any weight, then I'm going to take this bottle of water. I don't know if you can see this. I'm just going to hold it, and I'm going to drop it. All weights drop. Gravity does that. I'm going to lift her arm, and it kind of lagged instead of falling. By doing subtle little motions like that and attending to releasing and letting go and using the force of gravity, you can gain an appreciation and start to reduce your pain. Beverly, thank you for being a participant.
My pleasure.
I'll talk to you more. I'm going to sit down again. I want to show you some other images. Alexis, would you put on the next set of images? As you can see, we have somebody sitting on a bed of nails. We have somebody walking on fire. These are individuals who used these principles and other principles in this book, and they've taken it to the max. They've practiced mind healing abilities. There are estimates that we use 10 to 20% of our brain's capacity. Well, these people have taken it up many notches. Now, I'm not saying you should train with these methods, but by utilizing these techniques, you can increase your mind's healing abilities, and you can increase your wellness and decrease and or eliminate your pain. Alexis, please put on the last image. You recognize this image. This is Da Vinci's Mona Lisa. And it's sometimes called Gioconda, which is Italian for happy. This was done in the 1500s. The first image doesn't look very happy to me. It looks kind of mysterious and sometimes called enigmatic. I want to take you from the first image to the second image. She's joyful, and you can be joyful too. I've done this with many patients, and I can do it with you. You know what you have to lose. It's your pain. I want to help you.
take this opportunity and form a relationship with me. I'm going to open the floor to questions, and I'll be happy to give you answers.
All righty, and I'm going to bring our Jim Broach, of course, back. There's Jim. All righty. There's definitely a lot of chatter over on Facebook, so definitely wanted to see if anyone has any questions, or Jim, if you have any questions that you want to start off with.
Dr. Pollack, I was wondering, when you're working with Beverly, a lot of people have difficulty standing with CRPS. Can those techniques be done in a chair or even in a bed?
Certainly. Certainly. Every patient is different. You know that, Jim. And it has to be individualized. RSD can affect arms, legs, different parts of the body.
The other question, I was wondering if you could talk back about the subcutaneous needle and talk about
Yes.
that.
Yes, this is called perineural therapy. It was designed by Dr. John Liftoff, Lyfogt. He's a New Zealand physician who initiated this, and he found that it essentially resuscitated sensory nerves, and it's benign as far as side effects. And in my experience, it's been extremely effective.
And practitioners know to do this, or is this something that you're self-taught? Tell me more.
I was trained specifically by Dr. Liftoff, and you need specific training. And there are a number of people trained in this, and you can look up perineural therapy, PERINEURAL, perineural therapy. And there's a website, and there's a listing of people who are adequately trained in this.
That's great. Thank you.
When it comes to your technique, do you have any CRPS warriors, any patients who, work with you and then also have other tools? Maybe they have like a spinal simulator, or they use cannabis, they use ketamine. Can you talk about other things?
Sure. I'm not against using other medications. It's just been my experience that they don't cure you, and they're fraught with a lot of side effects. So I have no problem with people using those, but I think just to expect that that's going to do it. I found that if you explore the mind's healing abilities, there's a whole gamut of benefit that a lot of other physicians don't go into.
I think you're right. It's very fragmented, and more we're really studying the neuroplasticity of the mind. And it's just remarkable what individuals can do. The problem sometimes is that it's not covered by insurance, and it's just sometimes really difficult. That's why I was excited about that. By a simple telephone, they could be connected to you.
Yes, this is the pandemic was a kind of a trigger that got me into this idea. And it's laid out. There's a roadmap, and the interactive part, I think, is a very important part of this that I'm happy to be involved with.
Yeah, Dr. Pollack, I mean, we have a large community. I know you've spoken to other organizations too. I mean, how long does it take to get in touch with you?
It doesn't take long to get in touch with me at all. It's very rapid to get in touch with me. How quickly can they see me? I will see them personally. I have other help in the office who are specifically trained by me. We'll get them in. I like quick action, and I'm sure patients do too. And I'm not gonna let them just sit there for 6 weeks, a month, a couple months. That's not my style.
And just about also, just to understand better, will you work virtually with individuals? Because people are from all over the United States and Canada.
Specific virtually, I would prefer to work with the telephone and direct contact that way rather than specific virtually.
Okay.
I like direct contact with patients. The more that I can do that, the better.
I understand.
I'm just scrolling through some of the comments, and there's a lot of chatter, just about different techniques that folks have been using. I did see a comment that I definitely wanted to call out. Melissa, who said, like, for me, the mind/mental is 50% of pain management. And we've definitely seen a good number of warriors who have mentioned that over the years. So, of course, once again, if you do have any questions, be sure that you're leaving those in the chat. I think you may have mentioned this somewhat in the last question that I asked, but I just saw someone also add this to the chat. So, is there any medicine that you specifically use for the perineural therapy?
Yes. I use a high-grade dextrose solution that's buffered specifically. And it's very natural. And when directed at the specific site, it resuscitates it. To be more technical about it, when a nerve is stimulating, the end receptor gets depleted of its energy source, which is a glucose dextrose solution. So by putting this in this territory, it is like a temporary resuscitation. And with repeated treatments, if you're a responder, it shuts it off. With complex regional pain syndrome, RSD, there's a hypersensitivity in this neural system, and you get central sensitization. So that has to be dealt with.
Yeah. Dr. Pollack, I've read your book. And I was impressed by it. Could you just talk about some of the different chapters that you didn't talk about today? Because you haven't even mentioned diet yet, which is incredibly important.
Right, that is one of the chapters. I start by addressing the distress of pain and talking about how you address it. I talk about the assistance that's available through the call number. Then there's a chapter on belief, breathing, the habits we get into, consciousness and unconsciousness. Some of the pioneers of pain treatment, exercises to prevent, which is standing, walking, and sitting. I talk about diet, and I label it, you are what you eat. There are pain relief procedures, case studies, and the Pollack plan to purge pain.
Thank you.
We do have a question from someone over on Facebook who says, if we purchase your book, can we practice some of the techniques at home before we see you?
Definitely. That's the purpose. I want you to. I want you to get to the point where you don't need me. I want to help you become independent.
Awesome. I'm just responding to a comment that we had. I'm trying to see if we have anything else. Here's a question from Tina. Can your peritoneal treatment be done with those who have spinal cord stimulators?
Definitely. There's no contraindication to that.
Hmm.
This is extremely safe. You're not talking about some foreign agent. Worst comes to worst, the only side effect I've ever noticed is people who are extremely sensitive, a little temporary skin sensitivity.
Yeah.
Other than that, you're not talking about any systemic difficulties.
And we know our warriors are familiar with skin sensitivity, definitely.
Yeah, and there's a lot of, within our community, a lot of phobia about needles too, so.
Yes, yes,
Yeah.
I understand that. It's extremely fine and very tolerable.
And how much is your book? Is your book $10? I don't know how much your book is now. I forgot.
The book is $20.
$20. Okay. And I would like to say from RSDSA, if people can't afford the $20, want the book, just email me at info@rsds.org and we'll make it available for you. We want
That's
anyone prevented by finances.
Nice of you.
Mhm.
All righty, I'm doing another search of the comments, but I believe we have gone through most of them. I know there is still a lot of chatter in here, but I'm not seeing any new comments, but you all always know where to find us if you do need to ask a question. Here's a question from Terry that just popped up. How many patients have you treated, Dr. Pollack?
With this condition is the question, or in general?
It doesn't specifically say, but I would say with RSD/CRPS.
Off the top of my head, at least 100.
Awesome. And then here's another question. Have you ever seen acute pain cancel out RSD pain?
Oh, you can have acute pain from other conditions, cancel out. Sometimes the focus shifts, and that does alter the original RSD symptoms, of course.
Definitely.
The answer is
Right.
yes.
Definitely. We're seeing some more questions come through as we are chatting. Someone's interested about the diet chapter of your book. I know he's not going to tell us all the goodies that are in that chapter, but someone is talking about they're interested in the diet chapter.
Well, diet has an effect on you.
Right.
There's an old statement, you are what you eat.
Right.
It is a factor, and I go through different studies with it and lay it out.
All righty. People asking about the email address, of course, to reach out about the book, info@rsds.org. And I did put that in the chat as well. But I'm not, someone asking if this will work if you have ketamine. It seems like regardless, whatever other treatments
Well, ketamine is an anesthetic.
Yeah.
Ketamine, before it became popularized on the street, was known as Special K. It can be hallucinogenic. It's an anesthetic, and it has some merit, and it's popularized now. And I have no problem with people using it, but don't expect it in and of itself to be a cure.
We're talking about really a multi-pronged attack. Really,
Of course, and individualized too, because everyone sees things and does things in different ways, and that impacts the way their responses are and their neurochemistry is.
I agree.
Well, it looks like the questions have kind of slowed down. So Dr. Pollack, I want to know if you have any last statements, anything you want to help us sign off with this evening.
Well, when we are ready to sign off, and if this is it, I will give you my final comments. You want to wait just a minute and see?
Oh, here's someone else popping up. Is this
Okay.
treatment?
All right.
Is this treatment good for someone with sleep apnea? I'm not sure this person, I'm assuming this person also has CRPS as well.
Well, sleep apnea is an entity in and of itself that has to be addressed. And it can certainly impact this condition, because if you're not oxygenating well, that's going to affect your pain level. No doubt about it. So directly, no, but indirectly, yes.
Sorry, just responding to another person here. All righty, trying to see if anything else. Thank you so much for joining, Beverly. Just left a nice comment here. But yeah, I do think that we are ready to wrap. So Dr. Pollack, we will turn it over to you for the final statement.
All right. Well, the final statement is, as I say in the final statement of the book, I want you to focus on striving to have eyes that see the best in people, to have a heart that forgives the worst in people, and to have a soul that keeps the faith.
Amen. Dr. Pollack, thank you for
Yes.
taking time out of your busy schedule.
Yes,
You're
thank
welcome.
you for all of this great info. Now, as always, I know some of you are new to the community, or maybe this is your first Facebook Live, but we will have this video pinned to the top of our Facebook timeline for easy access if you want to rewatch it. You can also rewatch it on YouTube, or maybe you have friends or family or other people who are CRPS warriors who want to watch it and they don't have Facebook. We also upload these videos to our YouTube channel so that you can go there and watch them as well. We will also add a link to the presentation in there as well. So if you have any questions for us, or if you're looking for a support group, if you're looking for a new physician, or if you want to tell your story on our blog, or if you are interested in purchasing the book, be sure to send us an email at info@rsds.org. Also, be sure to send us a message here on Facebook or an email if you have any ideas or anyone that you want to see come and speak to you all. We are definitely planning out our 2022 Facebook Live schedule. So we want to make sure that we are bringing on physicians and professionals that you are interested in hearing from. So definitely let us know. And that's it. That's it for this evening. So everyone have a great one.